As a land of 57,000 square miles of Bangladesh, with more than 160 million populations, people are suffering from various health problems. Because of geographical location, low literacy rate and financial crisis, the problems become acute. Lack of consciousness, late diagnosis and inadequate medical facilities are making disease incurable for patients. In Bangladesh, we have only 5.8 doctors for every 10,000 people, whereas the minimum requirement is 12 doctors. Due to the absence of qualified doctors in rural areas, patients often take unsafe medical service, and this makes the situation more complicated. On the other hand, people cannot afford good medical care from urban hospitals because of financial problem. To overcome the doctor shortage and inadequate medical facilities in the rural areas, Portable Health Clinic (PHC) is a revolutionary invention. This is a joint initiative of Kyushu University, Japan and Grameen Communications, Bangladesh to ensure the Universal Health Coverage (UHC). This will bring the healthcare service to the doorsteps of the unreached communities of the developing countries in an affordable and sustainable way. And yes, it is a smart portable box like a briefcase which is directly connected to a server system and remote doctors in call center. PHC enables physical checkup using automated medical equipment and transfer the vital data directly to the call center doctors for their reference. To take PHC service, one should register online first. The registration is verified by a barcode. PHC measures BMI, blood pressure, body temperature, diabetes, hemoglobin, urine tests, etc. Based on the test results, PHC triage system classifies subjects in 4 categories: green, yellow, orange and red. Green. If the test result is green, it means the subject is healthy and safe. Yellow means one or more results of the test are not good but not in danger. Orange indicates the subject is in risky condition who needs doctor's consultancy. Red indicates that the subject is a serious patient and should see doctor immediately. Orange and red category subjects are to be connected with a call center doctors through video conference. Doctors verify the problems and symptoms and deliver the required medical consultancy with prescription. PHC has been primarily developed for providing basic healthcare services, with a special focus on non-communicable disease (NCDs). What is the main cause of deaths? However, there are many patients who need other types of secondary or tertiary level of treatment. To address these demands, PHC has gradually added new modules like telepathology, tele-eye care, and maternal and child health care. Recently, COVID-19 module has been added to tackle this pandemic. Telepathology. In telepathology, a trained PHC laboratory technologist collects samples from the patients, prepares glass slides, produces 6 to 10 different microscopic images from different angles and uploads to the PHC server. Then the PHC pathologist accesses to the images and produces a report which is preserved in the system. Finally, the concerning physician can see the report as reference and prepare the prescription. PHC telepathology service covers hematological report, biochemistry report, microbiology report, urine report and stool analysis report. Tele-eye care. Tele-eye care is a service for the patients of any age. A healthcare worker takes retinal images of the patient using a digital camera in a prescribed format and uploads the images to the PHC server together with physical observation report. A registered ophthalmologist checks the images, talks to the patient over a video call and finally gives a prescription of the patient. PHC tele-eye care service covers the following eye tests: primary investigation, vision test, final examination, refraction, glass prescription and eye prescription. Maternal and child healthcare. The aim of the project is to help the rural pregnant women and newborn babies where access to an obstetrician and gynecologist is difficult. We are following WHO guideline to monitor a pregnant woman and newborn from the beginning of her pregnancy up to 6 weeks of the child age. A total of 8 checkups are provided during this period with the help of PHC rural health workers, followed by teleconsultancy by a gynecologist in the city. PHC for COVID-19. It's a new expansion of PHC system added during the COVID-19 pandemic in 2020. This system has a triage function to accurately classify suspected patients only who will be recommended for PCR test. This will reduce unnecessary testing cost and the pressure in the test center with limited resources. But right people who needs the test will have the test. Based on the test results, system classifies subjects in 5 categories: green, light yellow, yellow, orange and red. Green means the patient is healthy and safe from COVID-19. Light yellow means the patient is slightly doubtful and should maintain home quarantine under the safe monitoring. Yellow means the patient is doubtful and should maintain home quarantine under the supervision of PHC health worker. Orange means the patient is suspected COVID-19 who should immediately talk to PHC call center doctor and should go for PCR test if advised. Otherwise, the patient should maintain home quarantine under the supervision of PHC health worker. Red means the patient is highly suspected and should go for PCR test or to COVID-19 hospital immediately and go under their follow-up. The PHC for COVID-19 system can also be used for the treatment and follow-up of the home quarantined COVID-19 suspected or mild state positive patients from distance. It contains various self-checking medical sensors for patients' health monitoring, including a COVID-19 system application in a tablet PC for communication between patient and doctor for teleconsultancy, maintaining a safe social distance. This ensures safety of both the patients and the health professionals, what is very important for the highly infectious disease like COVID-19. Initially, PHC aimed to deliver telemedicine-supported healthcare services to the rural unreached community only. But gradually, it was realized that PHC is equally usable for the urban aging communities, corporates, factories, academic institutes, etc. Till June 2020, PHC served 43,448 people over 17 districts in Bangladesh, where 50% of them are rural, 13% urban and 37% suburban. Other than Bangladesh, PHC has been replicated in many developing countries including Cambodia, India, Indonesia, Liberia, Malaysia, Pakistan and Thailand. Recently, the demand of the telemedicine-based healthcare service delivery is increasing and even many developed countries are also showing their interest in the PHC, especially for the aging communities. The global healthcare team of Kyushu University has been continuously working with the partners in other countries for further development and expansion of PHC system with the mission of fulfillment of the Sustainable Development Goals (SDGs).